Hello, and welcome to Animal Chiropractic Clinic Chatter, a podcast where Dr. O from All Creatures Every Spine interviews doctors and animal owners that utilize animal chiropractic to get their unique perspectives. Yes, it's really a thing. Dr. O utilizes his 30 years of experience as both an animal chiropractor and veterinarian, and to dig deep into the discussion of complex issues affecting the lives of your animal friends and companions. Join us for this educational episode.
Hey, just a quick reminder, we have several events coming up soon. We have the advanced Atlas adjusting for dogs coming up in March. We have the advanced Atlas adjusting for horses coming up this summer. And then, of course, we have our food animal coming up in the fall. So go to the website, www.animalchiropracticeducation.com. Take a look, find those things, sign up. If you're not already certified, then you want to take Animal Chiropractic 101. That starts the day you sign up. You can become certified if you're a veterinarian or a chiropractor. You can become certified in as little as a couple months. So go ahead, take a look at the website, and thanks for tuning in.
Thanks for joining us for this portion of the episode as Dr. O begins to answer the question, what is animal chiropractic? He will look at how the chiropractic adjustment is a valuable and viable treatment for what ails your animals.
What is animal chiropractic? Animal chiropractic and human chiropractic both have one thing in common. Neither one of them are meant to treat or cure any problems. The only thing that chiropractic does is remove nervous system interferences from the body, which allows that body to perform at its optimal ability, which may or may not be the resolution of the symptoms that the animal is bringing to us. Are they healthy enough to respond? Do they have a proper diet? If they don't have the proper building blocks, they can't get healthy. Do they have a proper environment? Are they living in a house with a lot of secondhand cigarette smoke? Do they get some exercise? Do they get outside? Do they move around? Movement is life. Without movement, we're going to die. Historical data shows that chiropractic care increases the likelihood of survival during a pandemic. Look back at 1918, the flu pandemic back in 1918. And today, science validates why chiropractors of the past and present have these incredible results with immunity. We know what happens with the adjustment. It has been proven that we can increase this stuff. All right? Medical examiners looked at the size of the tumor to make a prognosis about future health and recovery. And that wasn't very good. But now research from 2014 proves that the health of the nervous system directly influences the strength of the immune system. A whole bunch of patients were looked at, and a healthy immune system even helped cancer go away. So change the process altogether. The most important prognostic factor in determining whether you can recover from a lot of different things is the vagus nerve. What's going on in the vagus nerve? It directly connects the body's ability to prevent sickness and recover from an affliction. Pharmaceutical labs and medical professionals, responded to the discovery by initiating development of new drugs and technology based on improving the function of the vagus nerve. But we know that the chiropractic adjustment improves that. One of the things that they want to do for people with epilepsy, have a son with epilepsy, is they'll put a vagal nerve stimulator in there. You know what? The chiropractic adjustment of the atlas stimulates the vagal nerve. So chiropractors right now aren't allowed to say, that, hey, the chiropractic adjustment improves immunity, because chiropractors are their own worst enemy. There's so much infighting. Watch a movie called Doctored. If you're in doubt of that. But chiropractors need to get along because we all have this amazing tool that helps the body use its amazing tool, or the innate ability. And we know that innate responds to the environment that it's in right now, and if that environment is hampered by bad hearing, bad vision, bad proprioception, through interferences in the nervous system, we're going to have problems. So as an animal chiropractor, my job is to look at your animal to remove all the nervous system interferences from his spine so that the toes can communicate with the brain, so the brain can communicate with the stomach, and so that the animal itself can be as healthy as possible and it can maintain a healthy status. So, what animals need to get adjusted? Any animal that has a spine, needs to get adjusted. We adjust chickens. We start at day of age, day one of age. As soon as they hatch, we try to get them adjusted. We adjust the day before slaughter on those. We adjust dogs. We adjust old dogs, geriatric dogs that just, they've retired or they're house pets and all they do is sleep on the couch. We adjust those once a month. High performance dogs, some of those we adjust every 2 weeks. We've got some rodeo horses that we adjust every 2 weeks. Other horses we adjust every couple months. So what do you want to get out of your animals? To get the best performance out of your animals, get them chiropractically adjusted on a routine basis. Thank you.
Make sure to visit our website, allcreatureseveryspine.com, where you can subscribe to the show and learn more about getting your animals adjusted. If you are in the Meridian, Texas area, drop in on a Tuesday afternoon to get your animals adjusted. If that isn't possible, schedule a consultation on your animal's health with Dr. O. You can also purchase a copy of Dr. O's book. Yes, it's really a thing.
Helping others experience an abundant life with the gift, art, and blessing that is animal chiropractic is our sole mission at ACES. It's what we do. It's what we love. It truly is what keeps us motivated to help people just like you. I truly love the art of chiropractic. It drives me to providing the highest level of chiropractic possible. And as fellow chiropractic business owners, it's that love that drives us to become better. However, the reality is that sometimes running a successful business can be challenging. Sometimes there can be obstacles to overcome, right? Yeah, we all know the old saying, if it were easy, everyone would do it. Well, one thing that is really easy is marketing our clinic with a professional animal chiropractic website by the Chiro Website Pro, Tony Seymour. He's a professional web designer, and his team at the Chiro Website Pro take good care of us. They simply make marketing our practice 100% hassle-free. If you're looking for the number one hands-free way to market your practice, give the Chiro Website Pro a call at 423-779-4630 or simply visit www.chirowebsitepro.com and make sure you ask them about the special ACES discount and let them know Dr. O sent you. You'll be glad. Glad you did.
Join us as Dr. O interviews a certified chiropractor, veterinarian, or an animal owner. These enthusiastic people explain how they utilize animal chiropractic to alter the lives of the animals in their communities.
All right, everybody. Hey, welcome to another session of Animal Chiropractic Clinic Chatter. I'm your host, Dr. O, and today we have the Dr. Prentice. So tell us a little bit about yourself, Doc.
Well, good morning. As Dr. O said, I'm Dr. Dusty Prentice, and I live in Southern Arizona. I have a predominantly equine-only practice, mostly focused on dentistry and chiropractic care.
All right. So when did you add chiropractic?
Well, I signed up for the ACES course quite a few years ago, back in 2017, and I finished up and graduated in December of 2020.
Oh, so you were one of the ones that used our flexibility option.
I definitely use your flexibility option to its full extent, yes.
Yes. And, but were you doing some chiropractic after you came to Module 1?
I was. Definitely felt comfortable doing work with the atlas and the sacrum after Module 1. So I was starting to incorporate that into my practice. And the more I learned after Module 2, I incorporated more of the spine. And then certainly after Module 3, I hit the ground running.
All right. And how has animal chiropractic changed your clinic and life?
I would say it's kind of turned it a whole 180 degrees. Basic medical philosophy is, for me, was to, find something wrong and name it and treat it. Spending the last couple of years learning animal chiropractic at ACES has given me the ability to look more at the entirety of the animal, understand the power of the nervous system of the spine, and to be able to help the animal by just adjusting that so it can heal itself. And now instead of looking for a condition or a name, I just look for subluxations, adjust those to the best of my ability, and then give it some time and see what else comes up. So it's changed my philosophy of practice and care completely.
And for the better or for the worse?
Absolutely for the better.
For the better. Your patients are glad, aren't they?
I think that they are, yeah. My clients definitely are, and my patients are more healthy, more vibrant, living longer with less pharmaceuticals and doing their job better.
All right. So even though you're predominantly equine, all right, I think you had a couple dog wins too, right?
I very much so did, and those were huge for me because the dog species isn't something I've ever really worked on. I went all the way into equine practice when I graduated 16 years ago. So occasionally I'll do dogs for clients at their farms, and I came across a 2.5-year-old Great Dane that was having some trouble in the forelimb. And the owner had been to multiple veterinarians and had a lot of workups done and really never got an answer. So I took a look at the animal and I said, well, we have some issues in the lower cervical region, upper thoracic, just based on my palpation skills, which I learned at ACES, and my knowledge of the nervous system. I said, well, would you mind if I adjusted the animal? And I did. And he wouldn't immediately lay down. I said, well, he's kind of taking a nap, let him rest for a little while. And he got up and he trotted off. And this dog hadn't trotted in a long time. Now, this is a Great Dane that's bigger than I am. And we kind of look at each other. And every time I get a win like that, whether it be a horse or a dog, my jaw just kind of drops and I jump up and down. I said, did you see that? Did you see that? And the hardest part is for me is doing the videos before I adjust them, because I always forget, or I think, well, if this doesn't always produce a stellar example, maybe it won't make a super video, but it always produces a stellar video and I always forget to use it. So that animal actually went on to get a CT scan And it turns out that he did have some stenosis in his lower cervicals and upper thoracics, pretty significant amount that he was probably born with. And it, as he aged up into this 2-year-old age, had some trouble with some spinal nerves impinging and causing problems with the gait. But now I'm working on this animal every 2 weeks, and every time I see him, he gets up and he trots around, and he's doing amazing. So that's not something I've put out on social media or Facebook, because I'm definitely, I have plenty of work doing horse stuff. So it's more I just do this as a favor for one of my clients.
Well, and I understand, but so he does have a congenital problem that traditional medicine would not have been able to help, but through chiropractic care, you are allowing him to live a normal life, even though he still has those congenital problems.
Absolutely. He was actually, after that CT scan, slated for an MRI and surgery with a neurologist, but the owner was so happy with how he did after chiropractic care that she's not going to go through with the surgery for him, because that would have been extremely risky and very expensive too.
Yeah, you can get a lot of adjustments for the cost of an MRI.
A lifetime's worth. Yeah.
Yeah. So what about horses? What's your biggest horse win?
You know, I have a few ideas in mind of what my biggest wins are. There's definitely a few cases that touch my heart a little closely, both for the animal and for the human. But honestly, I have huge daily wins with horses, stemming anywhere from chronic lameness issues, acute lameness issues, inappetence, all sorts of gamuts. But I guess the biggest case that stands out to me is a 35-year-old quarter horse gelding. He used to be a racehorse, and he's been retired for 15 years, I think, at least, on this ranch in Sonoy, and I've been caring for him that whole time. He's just brushed, fed, and loved on. And about a year ago, he came up with a neurological condition where he was walking in a C shape, and then he was falling down. Now, I think he was 34 years old last year when I started working on him. I would have probably 2 years ago, before ACEs, given him some bute, maybe stall rested him, maybe not, and said, well, you know, Connie, he's an older guy, he's got some spinal arthritis, this might be the end of the road for him. But I asked the owner, I said, can I please adjust him, and we'll give him a little bit of time and we'll see what happens. I did not put him on any medication. I did nothing more than adjust him. And after his adjustment, he was slightly better. He moved less in a C-shaped, and he was able to actually walk around without falling over. I said, well, let's give it a few days and see how he does. So the owner sent me a very, very grainy video in 3 days, and this horse was walking straight and actually decided he might take a couple of trot steps, which he really hadn't in years. He just walked around. So not only did the chiropractic care bring him back to his previous level within 3 days, but it allowed him to exceed what his normal level would be. And so I see that horse about every 2 to 4 weeks, depending. Sometimes he decides to rearrange his spine a little bit, dunking his head in the water bowl and rolling and doing what horses do. And you know, he comes up a little sideways, I adjust him, and he goes off beautifully for 2 to 4 weeks. So the owners have been ecstatic. They say, come whenever you'd like. And the horse just, I mean, he's just amazing at 35 years of age, doing so wonderfully. But 2 years ago, he would have been gone. Yep. Because I didn't have the education and the knowledge to be able to help this animal. And now I do.
Cool.
So
big wins. All right. So what do you have for advice? So, you know, I talked to somebody yesterday or previously, and, you know, they went through the program in under 4 months, and they just got it done. And now you, on the other hand, used our flexibility option. And what about getting to module 1? How important is it to get to module 1?
The hardest thing for me to start was the online learning curriculum. I always made an excuse like, well, I can't do it today, or it's too late, or I've got this, or I've got that. But once I delved into it, I started getting discouraged, like, oh man, these quizzes are tough. But then once I understood that they were more designed kind of as a learning tool more than anything else, I was more okay with diving into it, getting it done, texting you multiple times, hey, what about this? Hey, reset that. And it just became familiar to me. And then once I was at module 1, the whole idea shifted about online learning for me, because it really did set me up for success in that first module, which was the most difficult one for me to get to prioritize my time in order to finish that.
Yeah.
So very important to start me on the path to finishing this.
Well, and once you came to module 1, you had enough tools that you could start to actually get a return on your investment, correct?
That is true, absolutely. So I was able to start bringing money in for my practice with the knowledge I had learned in module 1.
Cool. So before ACEs, your practice was mainly dentistry?
Yeah, it was about 90% dentistry.
And now about how much chiropractic?
I was looking back in my toolkit in my software, and I would say it's probably about 75-80% dentistry, and the remainder of it is chiropractic care, with a couple of other things thrown in now and then. Yeah. Emergencies mostly.
Cool. All right. Do you find that the horses that get adjusted have fewer emergencies?
When I started my practice 15 years ago, I was the only doctor in my area, and I had a lot of emergencies, and most of them have kind of petered out over the last 5 to 10 years, just simply because of changing the way animals are housed and managed, and educating the clients. And of course, dentistry is a huge part of that. But honestly, the missing link was chiropractic care. I do so very few emergencies anymore, other than animal ran through a fence, the occasional colic. But other than that, I'm able to keep animals healthy and out of the emergency room, if you will.
Cool. That's always exciting. All right.
Yeah.
What do you wish all of the horse owners in your practice knew about chiropractic?
I am trying to educate them about the power of the spine and the power of the adjustment to keep their animals not only healthy, but performing at optimal levels, whether a backyard trail riding horse, which many of them are in this area, or an eventing horse. It's so important to keep that spine aligned and the nervous system working correctly to keep the animal going. I wish they knew more about that.
Well, we try to help. Hopefully this will help. You'll be able to use these we hope our broadcast, get them out to your clients' hands. We'll get them into more people's hands. Any words of advice for anybody sitting on the fence, thinking about, I don't have time or I don't have money to add animal chiropractic?
Yeah, my biggest hurdle was the time investment, for sure. But after starting the course and then completing it, honestly, my schedule has freed up a lot. The chiropractic exam does not take very long, nor does the adjustment. So you can actually see a lot more patients in a lot shorter period of time and keep them healthy, so that you are preventing them from getting diseased, potentially injured, sick, or really the big part is, in most performance horses, lame.
And in your case, that gives you more time to spend with?
Yeah, in my case, it gives me more time to spend with my children, my young family. And that's made a huge difference in my life. So I wouldn't be spending as much time with my family now, honestly, if I didn't have chiropractic in my toolbox.
Cool. And that's what we're all about. So we have a lot of, today, the veterinary world is a lot of young mothers,
fathers too. I mean,
and fathers, so. Yes. Yeah. We have a lot of parents out there that have kids and they don't want to, because the traditional veterinary model is, what, 80 plus hours per week, right?
Work, work, work at the detriment of yourself. It very much gives you a work-life balance.
Cool. And so have you always been a month-long vacation person, or is that new?
No, that's kind of new. And I'm fortunate enough to own my own business. And so I can create my own hours and vacation schedule around that. And since I do mostly preventative healthcare and I don't have an emergency clinic per se, although I do offer 24/7 emergency care, it allows me the flexibility to be able to go on a big adventure with my family and just kind of take off and do that sort of thing. So I'm very lucky in that respect.
And has chiropractic helped you get that dream, I guess?
Yeah, if my patients stay healthy, I get less phone calls while I'm on vacation and everybody's happier.
Yeah, cool. All right.
Yeah.
So we're glad. Let's see, what else? What other questions were there? Is there anything that you wish we'd have taught you at ACES?
Anything that I wish you would have taught me at ACES?
Yeah, you're like, I wish I knew more about this.
I was just thinking that the other day, and I had a great thought in mind. I wish I knew more about, yes, next time I go over there for a lab, I'm going to ask them to teach me this. And that thought went right out of my mind. So I don't remember. I mean, I don't know what I don't know. And every time I come to rounds, doctor's rounds, or watch some of the older rounds, every time I chat with you or Dr. Amy, I go, wow, that's amazing. I'm going to incorporate that. So I learn something new every time I chat with you, every doctor's rounds, and I get better. And at the last lab, I said, this is so amazing. I know so much in such a little period of time. Imagine where I am going to be in 5 or 10 years. I'm so excited.
Cool. Yeah. It's amazing how when we spend time with like-minded people, we learn things. Because
Absolutely.
Every time I go to doctor's rounds, I learn something too.
Yeah.
And we learn something from our students all the time. So that's exciting. Anyway, yeah. So thank you so much for your time today.
You're most welcome. It's a pleasure.
And we'll get this out. I can't think of anything else. So have a great day. And appreciate your time. Thank you so much.
All right. Have a great day.
You too.
Bye.
Bye.
If you are or know a veterinarian or chiropractor, or a student of either of these professions, visit our website, Animal Chiropractic Education Source, to see how to become certified in animal chiropractic. Start improving the lives of the animals around you. Welcome to Dr. O's opus of animal chiropractic. Chiropractic consists of 3 parts: the art, the science, and the philosophy. This last segment of today's podcast is loaded with the philosophy and principles of animal chiropractic.
Welcome once again to Dr. O's opus, the what is animal chiropractic and why is animal chiropractic what it is. A lot of people don't understand how important the first cervical vertebra is, or the atlas, and it's so amazing what the atlas does. So first off, almost every nerve in the body goes through the hole between the base of the skull and the first cervical vertebra, or they come out around there, all but 2, the smell and sight. But even sight is affected by the muscles or nerves that come out there, because there's muscles that move our eyebrows, muscles that let us look side to side, those kinds of things. So sight is involved even at this first cervical vertebra. Chewing is involved. There's almost nothing that is not involved with this first cervical vertebra. So all the nerves go through there, and we know that if there's any swelling, it's going to put impingement on the nerves, and the weight of a dime or a feather, depending on who you talk to, decreases nerve transmission by at least 50 to 60%. So wow, pretty significant.
what's decreased nerve transmission mean? Means that you're not going to get the cell signal on your phone. So instead of hearing every word, that's pretty annoying when you can't hear every word I say. And so that's what happens when you have nervous system interference. It affects every nerve in the body when it's that first cervical vertebra. The brain and spinal cord are covered by this tough membrane called the dura. And, pretty much in vet school, we just learned that there's the dura, protects everything. But we never really learned much about it. And one day, when we were teaching early on in my teaching career, we had one gentleman teaching veterinary basics to chiropractors in one room, and another doctor was teaching chiropractic basics to veterinarians, and I happened to be walking through that room, and he said, "Hey, Dr. O, lay down." And so I laid down on the table, and he had me turn my head and did some stuff, and of course I couldn't see what he was doing. And 7 veterinarians simultaneously went, "Ooh," and I was like, "Whoa." For 7 veterinarians to go, "Ooh," there's usually blood or pus involved, and I was pretty sure that there was none of that. So he said, "Well, I'm just explaining dural torque." Okay, what's dural torque? So started looking at these animals, and what happens with dural torque is that if there's a first cervical subluxation and you laterally flex the neck, the dura pulls the sacrum, actually changes the leg length. Okay, I know, kind of weird, but it does. It also puts pressure on every nerve on that side of the body, so it gives a little tug. All right, wow. So pain, boom, boom. We see in our practice that if we can correct leg length and don't do anything else, over 90% of our patients get better just by correcting leg length inequalities, getting these animals even, and removing that dural torque all through the first cervical vertebra. Wow. Okay, so we took care of the dural torque. We took care of the, pressure on the nerves. Well, what else is there? Well, the vagal nerve goes through there. Okay, that's one of the nerves that goes through there, the vagal nerve. Vagal nerve is very important in sympathetic, parasympathetic balance. It's important in heart rate. Heart rate variability has been proven to show the more variable your heart rate is, the more you are in a flight state. So you're not very relaxed. You're not going to digest your food right. You're not going to heal. You're not going to have the ability to respond to adverse changes in your environment as well. So if we can get your vagal nerve tone better and the vagal nerve tone of your animals better, they will be able to respond to changes in their environment. They will be able to adapt better. So getting that vagal nerve tone correct, okay, and symmetrical. I looked at a dog the other day that had a slight limp. We examined it, found a few subluxations, atlas subluxation, but the big thing that I noticed on this dog was that we had an inequality of muscle size. There was about a 40-pound dog, had a difference in 1 inch diameter between the right leg and the left leg. So how can that dog walk evenly with that much muscle difference? And it's all because of that nerve tone. The fastest way to lose muscle or to cause muscle inequality is to have a difference in nerve tone. So when we adjust the atlas, we're going to even out side to side, just like we talked about how, when you laterally flex the neck and you have dural torque, it's going to tug on every nerve on that side of the body. We saw another animal yesterday that had a huge atlas subluxation. It was a cat that was having difficulty going to the bathroom. So we're going to see, but I'm pretty sure that by leveling out that vagus nerve, by decreasing that sympathetic tone, that cat is going to have be able to use his own innate ability to digest his food better and get rid of waste products in a more appropriate manner. Okay. because that is what life is about. It's about the organism adapting and living in its environment in a healthy way. So what can you do to help your animals do that? Make sure you see a certified animal chiropractor for all your animals on a regular basis. And until then, have a great day.
Thanks for tuning in. Be sure to subscribe to the ACES channels so that you never miss an exciting episode.